Hello everybody, Suzanne from Donny Vision's Hypnosis. Today I'd like to give you an introduction in terms of what I am aiming to do with this channel and why it exists. Over many years I have been able to train mental health professionals in particular to better help their patients to overcome, not merely manage, but overcome many of the mental health illnesses that the conventional world of mental health say are impossible to do. And yet, I have clients that go back to 2005 who are doing amazingly well, who have these situations that they've overcome. Things such as depression, sometimes with suicidal ideation involved and worse, because the mental health professionals they went to and even the medical people were unable to help them. I've worked with the anorexics, generally those who are of normal weight but who are still having a lot of emotional, shall we say, messaging in their brain going on that's causing a lot of problems with boundaries and still hanging them up with some of their thoughts and behaviors and getting those all unlocked. Same with people who have bulimia, who are really worried about doing permanent damage to their gastrointestinal tract because they're rather aware that that's a possibility. And that's why they seek me out, because they have found that the conventional methods, inpatient, outpatients, have not worked for them. Sex addiction is another thing that I've innovated in, thanks to my clients teaching me exactly what I need to do in order to help them. And my protocol has helped them since 2005 to stop any and all of their sexual addictive behaviors and thoughts. Many of them going back to their families, meaning their wives and their children, and for the remainder to find really loving, respectful relationships, getting married and being happy many years later. So I know that these things are possible because my clients have demonstrated it. However, before I got to that point, in my understanding, I started out as a mental health client myself. I had basically bipolar 2, which was in the days when I was diagnosed, manic depression, because that was all the way back in 1989, before bipolar existed as a term. And I was on medication for many, many years and seeing various psychiatrists, of which one I saw for over 13 years, who was wonderful, but still she was very limited in terms of what she could offer me in terms of treatment, because after a while the medications that she was giving me were toxifying my kidney, slowing it down. And luckily she was smart enough to realize that I needed a creatinine level, which is a 24-hour urine collection, and then they do testing on it. And so she took me off the medication. It was at that time that I went for a program called the Advanced Evolution Program with Tad and Adriana James, where I was able to totally let go of the bipolar 2, manic depression, whatever term you'd like to use, in about 5 minutes, using his neuro-linguistic programming technique called timeline therapy, something that he actually created back in the 80s. And it works really well. It's different than walking the timeline and all these other things. He has trademarked it, and it's a wonderful, wonderful way to help people to let go of negative emotions and limiting beliefs. In this case, I had to let go of 3 negative emotions. Now, what I want you to understand is that it is totally possible for people to shift their dysfunctional thinking into functional thinking when we have the right processes and techniques to help them do that, along with a treatment plan that works in having them do that, along with something called a compelling future. You see, a lot of people hold on to their illnesses because they get something called secondary gain. I had one case with one client in particular many, many years ago, who was basically living with her boyfriend, who was paying for everything that she needed that her disability payments did not. And she needed to be able to let go of that secondary gain to be able to go out on her own and to complete her doctorate in education, which she did indeed do, interestingly enough. So there's many, many things that we need to take under consideration when we're looking at how we work with our patients in terms of helping them to be the best that they can be and holding a space open for them to actually do real healing work so they do not need to have the symptoms that created the diagnosis that they have the label for. As far as I'm concerned, my job is to delabelize as many of my clients as possible. Now, the thing that we need to understand is that when we're looking at people with real personality disorders, I'm not talking about people who have some of the symptoms of personality disorders. I'm talking about people with full-blown personality disorders. I am unable to help them with hypnosis and neuro-linguistic programming. That's just a reality, and that is something we need to understand. I also am unable to help people with psychotic features. I have worked with a couple of clients who had psychotic features, but not to remove psychotic features per se, all right? I had one, I think it was like 26-year-old kid who came in to see me who was using marijuana. His parents wanted him off it. He had schizophrenia, but he was functional. He was doing really well. He had a full-time job. He was making $40,000 a year in a competitive job working for the city in which he lived. He was going to school part-time online and doing really well, and he was working out every day. Who am I to tell him that he can't use a substance that's helping him function to that high rate with something known as schizophrenia? Because we in the mental health world know how few schizophrenics actually are that high functioning. So that was one of the cases. And then a second case was a gentleman who came in to see me who was a sex addict, and he was flashing, and he needed to stop it. And I don't really believe he had schizophrenia. I believe he had bipolar with psychotic features after working with him in different situations and seeing him in different situations over the years that I've known him. And yet he was able to let go of the sex addiction. I didn't find out about the psychotic features until pretty well into the work that we had already begun. So, yeah. And it worked. It was fine. So we need to understand what we're able to work with and what we're not able to work with and how to work with it. And to know that just like we want to have lives free of all these problems, our patients and clients want lives free of all these problems. But the question is, how do you make that happen? And the way that you make it happen is to learn how the subconscious, unconscious mind actually processes information so you can actually do the transformative work in the subconscious mind, which would be analogous to the hippocampus and the amygdala of the brain, which is how hypnotism works. And neuro-linguistic programming, being a form of hypnotism, works in the same way, regardless of what some of those NLP people think and believe. They were not trained correctly, and they do not know what they're talking about. I am telling you that anytime you bypass the frontal cortex of the mind, you're entering the emotional mind, which is the amygdala and the hippocampus, and that's how this work actually works. But unless you understand how hypnotism and neuro-linguistic programming works and how to use it effectively, you're not going to be able to help your clients to gain these wonderful gains in their lives and be able to let go of their problems once and for all and move on with their compelling future. The reason to let go of all this crap in the first place, because all of us have a greater purpose in this life. All of us have dreams and aspirations. And the best way to reach our dreams and aspirations is to let go of the things that are no longer working for us and bring in the things that do. And that means really being able to do things that matter to us, that show meaning and purpose. Something that Viktor Frankl brought out very thoughtfully in his book, Man's Search for Meaning, where the people in the Holocaust who had nothing to look forward to died, and those who did lived, such as Viktor himself. Just for an example. So I'm here to help and guide you to learn what is possible and why it may be worthwhile for you to integrate these tools and techniques into your practice. And as we go along, I will explain other things that you can learn how to do in order to build a practice that actually serves you. Because reclaiming your practice in your life is all about being able to control what is going on in your practice instead of other associations and regulatory agencies, while being able to bring in enough income so that you're living the life that you thought you were going to be able to live as a result of going through all the training and all the schooling that you did. And by the way, just so you know, I never, ever got licensed to work in mental health. Why? Because my very first mentor, who took me under his wing and made sure I learned hypnosis and NLP, was a gentleman who actually had gotten his PhD out of Boston University when I was about 3 years old, back in 1964. And he told me that once you learn these skills, you don't need any of that stuff. And you know what? It was true. He never used any of his psychology stuff. He gave up his license and he was just working in oncology at Beth Israel Hospital when I had met him, working with cancer patients. And he had his rules and regulations about what was being able said in those rooms with his patients and what cannot. And he had enough pull in the hospital that if anyone mentioned anything negative to any of his cancer patients, they were taken off the case immediately. Because we never want to give people with those kinds of really serious issues negative programming at all. And anything that goes into our mind, either from our own mind or from someone else's mind, especially someone with a white coat, who's supposedly someone you can respect and look up to as being a professional, will create something called white coat hypnosis, which means that those words that that person says carries a lot more weight inside the subconscious mind of the person who is hearing those words. So we have to be very careful in terms of the languaging that we use when we're speaking to people, but that's a whole different subject matter, but makes a point for you to understand that our words matter. Oh boy, do they. I'm going to close out this video with that and continue making the videos so that you can learn a lot more about how you can really regain a lot more of your time, increase your income, and have patients who actually are invested in working with you to gain their lives back. Because as far as I am concerned, that is the only reason to seek out a therapist of any kind for any reason. To let go of a pain or a problem that is really decreasing your quality of life, not allowing one to do the things that they want to do. All right, I thank you for spending your time with me. Till next time. Bye-bye all.